Hello, good morning, and welcome, welcome, welcome. I want to thank all of you for joining us today for this first ever NAMI Wisconsin Growing Strong Together virtual event. I'm Dr. Kay Jewell. I'm president of the NAMI Wisconsin Board of Directors. And although we're not able to meet in person for our annual conference, first in April and now, our staff and everybody didn't want to lose the opportunity to hear from some of the incredible speakers that had been identified and were going to present for us for the annual conference. So they worked very hard to create this event for us. So we're very grateful for all their hard work and creativity. So as you can see in the agenda, we have a lot to deal with, a lot we're going to be working with, including all of our speakers. We also will be able to be introduced to our 2020 Iris Award winners who've been selected from all the nominations by the board because of their incredible service, as well as you'll be able to access the Peer Leadership Council has created a video to introduce you to the leadership and what the Peer Leadership Council is about. Before we go into the day, I want 2 civic reminders. Please, if you haven't already completed the census, do so. We need to make sure we're all included, and also vote. If you need help with either registering, voting, or doing the census, please call the staff and they can help link you with the resources that you need for both of those. They're all very important to all of us. So before we get started with our keynote presentation, we'd like to do one more thing. Let's have a quick icebreaker poll. So here's the question. You have 2 choices. Would you rather A, never hit a red light again, or B, never have to stand in line for anything again? So vote. Which would you rather? Never hit a red light again or never stand in line again? Aha, I see. 71% would rather never stand in line again. That certainly in these times becomes a bigger issue than getting that red light. Very interesting. So now that we've had a little fun, let's get started. At the end of each presentation, we will have a 15-minute Q&A session. You can ask questions throughout the presentation by using the Q&A button or box, I guess, icon, and you'll see on your screen. Just enter your question in there and it will get answered. We please ask as many questions as you can. It will spark our conversation. At the end of our first presentation by Dr. Cook, Sita Deal, who is a NAMI Wisconsin board member, will join us as the moderator for the Q&A session. And now it is really my honor to introduce to you our keynote speaker, Dr. Judith Cook, and her presentation, Promoting Recovery Through Self-Direction and Wellness Management, New Evidence and Useful Tools. Dr. Cook is a professor in the Department of Psychiatry at the University of Illinois in Chicago, where she directs a federally funded research center along with numerous grants focused on intervention science and psychiatric epidemiology. She's an internationally recognized authority on mental health services, specifically the study of clinical and rehabilitation outcomes of children and adults receiving community-based care. Dr. Cook's recent work focuses on randomized controlled trials of evidence-based practice treatments for serious mental illness and the outcomes of individuals with co-occurring illness and chronic medical conditions. Dr. Cook, thank you so much for joining us today and sharing with us your knowledge.
Thank you so much, Kay. And thank you all for joining me virtually today. I'm very, very pleased to be here. I'd like to acknowledge the federal agencies that fund my center's work and point out that the opinions that I'll be expressing don't reflect their official policies, and also note that I don't have any conflicts of interest to disclose related to my presentation. Today, I'd like to talk about self-direction as a foundation for recovery from behavioral health disorders. I'd like to discuss the 8 dimensions of wellness and their impact on recovery. I'd like to talk about chronic illness self-management education and how it can underlie some of the work we do. I'd like to talk about financial wellness, which turns out to play a major role in general physical health and wellness. I'd like to introduce you to our solution suite for health and recovery. And finally, I'd like to end with some ways in which we can enhance self-direction for the people we work with. And I'd like to start with this concept of self-direction. And for those of you who are a little unfamiliar with the term, we're referring to the innate capability that people have to control their own lives based on their own self-understanding, their knowledge of other people and support from those people, and the world at large, and also their innate skills in order to manage their own acquisition of knowledge, motivation for changing their lives, and behavior. Self-direction is a concept that's grounded in the psychological theory of self-determination. This is a decades-long theory that has primarily focused on health behavior change and education. And there are basic building blocks of self-determination, the first of which is autonomous motivation. And when we're talking about autonomous motivation, we're talking about people who do things, change their health behaviors, because they internally feel that they want to. The behavior aligns with their sense of self-interest. They enjoy engaging in the behavior, and it's inherently satisfying to them. We contrast autonomous motivation with controlled motivation. And controlled motivation is engaging in a behavior because you feel pressure to do so, you want to please someone, or because of a negative emotional state, such as fear or guilt. You can change behavior with controlled motivation, but it doesn't last. The behavior change doesn't last. Autonomous motivation, behavior change does last, and that's what we're looking for. Autonomous motivation grows out of autonomy supportive environments. And when we're talking about health behavior change, we're talking about environments that are rich with information about options that people might have for dealing with a health condition or becoming healthier. They're also supportive, emotionally supportive. They acknowledge an actor's feelings in their reaction to, let's say, a chronic disease, and they promote people's sense of competence. Because the third building block of self-determination is an individual's perceived ability to be able to deal effectively with their environment, to deal effectively with whatever chronic health condition they might have, and also to be able to set and reach goals. So that's self-determination theory, and it's the basis of self-direction. And what I'd like to say a little bit about next is this concept of wellness. Many people think that wellness refers to physical health, but really wellness is much, much more than that. There are really 8 dimensions of wellness, and the ones we're the most familiar with are physical wellness, recognizing that you need to engage in healthcare and health promoting behaviors. And in mental health, we're all familiar with the emotional dimension of wellness, being able to have satisfying relationships and coping effectively with life and having a high morale. But there are other dimensions of wellness, such as financial wellness, that I'll be returning to today. Social wellness, having a set of satisfying social relationships that are mutual and that are both emotionally satisfying as well as practically satisfying. The spiritual dimension of wellness is very meaningful. People need to believe in a higher power. Some people choose to do that through engaging in formal worship, but others engage in mindfulness and other spiritual activities. There's occupational wellness, and that refers not just to holding a job, but also engaging in productive work like caregiving and volunteering and supporting your community. There's intellectual wellness, which is obviously going to school, but beyond that, lifelong adult learning, learning new skills, learning new things about the world. And finally, there's environmental wellness, referring to the fact that people need to live in safe environments that are enriching and that enable them to participate in their communities. Recently, what we have come to understand in the past 2 decades about what keeps people healthy is not just the formal healthcare system and health services and treatments and medications, but another set of dimensions that has as important an effect, particularly on chronic illnesses, as the healthcare system does. One of those is economic stability. We know that you can get the same healthcare services as another individual, but if you live in poverty or if you don't have enough money, your health will suffer. The neighborhood and physical environment determines an individual's physical health. I don't know if you've heard this phrase before, but your zip code has more to do with good health than your genetic code. And this refers to the fact that people living in dangerous environments or environments that are poor in resources and services tend to have poorer health. Education, health literacy, very, very important for determining whether or not people are healthy. Being able to eat nutritious foods, being able to access those, being able to maintain a proper weight is also an important social determinant of health. And finally, the social context and the community, the social community in which people interact is a very important determiner of health. Many people engage in health behaviors because they receive encouragement from their social network to do so. So what I want to focus on today are interventions, some of them led by peers, some by professionals, that pull together these 3 dimensions of health behavior change: self-direction, wellness in all of its 8 dimensions, and the social determinants of health. So let's take a look at what some of these interventions are. We're always a little behind the field of medicine in mental health, and for many years there's been an evidence-based practice called chronic illness self-management education. It's the kind of classes that you might be encouraged to take by your doctor if you develop diabetes, or an exercise regimen and accompanying information that you might get if you have just developed arthritis, for example. These are classes that are designed to increase an individual's ability to deal with and cope effectively with a chronic medical condition by giving them, first of all, practical knowledge about the condition, what its causes and treatments are, problem-solving skills, so that they can learn to live long-term with not only the symptoms of the condition, but also the side effects of any treatments they might be getting, emotional support so that they can feel better about themselves and their futures, strategies for dealing with medical service providers, advocating for themselves and making sure they get what they want and need, and also techniques for helping families cope with their diagnosis of cancer, asthma, heart disease. And finally, the confidence in being able to manage their health condition and being able to live a successful, happy life despite having a chronic health condition. These are evidence-based practices, chronic illness self-management education, and they've been proven to lead to higher levels of health and also functioning in the world, to an enhanced sense of emotional well-being on top of being able to deal with your chronic illness and being healthier. And finally, because let's face it, we don't want to spend our time in the hospital or the ER, a lower use of intensive and costly medical services, such as inpatient and emergency treatment. What you may not be aware of is that in the past couple of decades, models have been developed and tested to promote mental health self-management and help people deal with mental health disorders. And perhaps one of the best known is WRAP, Wellness Recovery Action Plan. I know you have WRAP all throughout the state of Wisconsin. And it's a model in which you receive peer support to develop a set of wellness tools and a plan for using those tools for recognizing what triggers upsetting and unhealthy feelings and behaviors and how to deal with those. And WRAP has been shown in clinical trials research to reduce psychiatric symptoms, particularly depression and anxiety, to enhance people's sense of hopefulness, to increase their personal empowerment and belief that they can affect their futures, to improve their quality of life, to enhance their ability to self-advocate with healthcare providers, including mental health care providers, and also reduce their formal service use, both mental health, and social services. Other similar models for mental health self-management include bridges, building recovery of individual dreams and goals through education and support, a model that originates from NAMI from Tennessee. NAMI peer-to-peer, NAMI ending the silence, and some other illness self-management models from NAMI. SAMHSA's model called Illness Management and Recovery, and Depression and Bipolar Support Alliance, DBSA support groups. All of those are models backed by evidence that help people learn to manage their mental health and any mental health conditions they might have. And more recently, as we've come to recognize that people with mental health disorders also have co-occurring medical disorders, we've seen the growth of self-management models for people with mental health conditions that concentrate on their health and their wellness. And probably the best known of all of these is WHAM, Whole Health Action Management, in which people learn about 10 dimensions of whole health, proper sleep and nutrition and drinking enough water, community service enhances wellness, spirituality, and also people learn to develop a whole health goal and pursue that goal and show themselves that they can actually enhance their overall healthfulness. Research has shown that WHAM activates people to engage not only in medical services and treatments, but also in general health management, such as proper nutrition and getting enough exercise. It improves their self-perceived physical health. It enhances their sense of hopefulness about their futures and ability to live a good life. And also, it enhances the likelihood that they're engaged in paid employment. And I hope all of you are familiar with the long line of research that shows that one of the major predictors of employment in our society is whether or not people are healthy. Other similar models backed by research are HARP, Health and Recovery Peer Program, a program called Taking Charge, and a model called Chronic Disease Self-Management Program. And all of these have been shown to achieve outcomes similar to the ones that are listed here for WHAM. So you may be asking yourself, well, wow, that's a lot of models, and I never really thought of RAP and WHAM and bridges and NAMI connections in that way, and didn't understand necessarily the psychological theories behind them. Which should people use when? And this is a really important question, because in chronic disease self-management for physical conditions, there are algorithms that people can use, doctors and others, so that, let's say, depending on what stage of diabetes your diabetes illness is in, you might be recommended to take certain types of self-management courses. We wanted to design a mental illness self-management algorithm for primary care providers, although you'll see in a moment it can also be used by others. You may not be aware of this, but most people with mental health disorders don't see specialty care providers like psychiatrists and psychologists. The bulk of people, particularly with depression and anxiety disorders, only see primary care providers. So it's really important that primary care providers understand that just like diabetes self-management education, there is mental health and wellness self-management education that they should be referring their patients to. Here's a look at the algorithm that we developed, and it was developed by a group of people in recovery, physicians, researchers, and representatives of many of these models. And we decided for this algorithm to concentrate on peer-led mental health self-management education. We decided to divide the mental health distress into 4 critical junctures. The first being, and remember, we're looking at this from the point of view of a primary care provider. So he or she may be dealing with someone who isn't diagnosed yet, but it's really clear they're under emotional distress, or they're reporting emotional distress like depression or anxiety, or when they're first diagnosed. Another critical juncture is when some type of mental health treatment is being started or being recommended or suggested. Another critical juncture is when mental health symptoms are worsening or during a crisis. And the final critical juncture that this algorithm deals with is when care transitions are happening. Maybe someone is ending psychotherapy or they're changing medications. And listed underneath these junctures are the types of education people need when they're first diagnosed, or when maybe they're first experiencing symptoms. They might want to learn a little bit about those symptoms and what anxiety is versus depression versus other types of mental health difficulties. When they're considering treatment, they probably want to receive some self-management education about medication options and other types of mental health treatment and peer support. When they're experiencing the worsening of symptoms or they're in a mental health crisis, by and large, peer-led mental health self-management education isn't really appropriate during this time. The group felt that only DBSA support groups might be appropriate here, and that what really is needed instead of that would be psychiatric advance directives or emergency services, warm lines, hotlines, that type of thing. And then during the time when people are experiencing care transitions, they need peer support for those transitions, as well as a full understanding of what types of care might be available to them, including alternative forms of care. And then based on what kinds of education is needed at particular junctures, you'll see recommended the models of peer-led mental health self-management education that primary care providers can refer their patients to. And you'll see DBSA peer-to-peer, DBSA support groups, NAMI peer-to-peer, and NAMI connections. You'll see many of the models that I talked about earlier, but you'll see some additional ones like hearing voices groups and Schizophrenia Alliance groups. And if you visit the algorithm, which is online, and the web address for the algorithm is at the bottom of this slide, what you'll see is that depending on the group that you select, you can click on a link and it takes you to a virtual location where you can participate in NAMI peer-to-peer or participate in a DBSA support group. The algorithm was designed for primary care providers because they interact with so many people that have mental health disorders, but it can be just as easily used by others, including peer service providers and peer supporters, family members and relatives. Obviously, mental health clinicians can use this information, as well as substance abuse counselors, but even law enforcement and nurses and educators can use this algorithm. I think it's an important tool for, first of all, normalizing these models of service delivery and sharing with people that they are evidence-based, they are effective augmentations to traditional care. And then also I wanted to introduce our algorithm group, which included representatives from many of the models that are featured in the algorithm, such as NAMI and DBSA, and the creators of WHAM, the Georgia Mental Health Consumers Network. So I want to encourage you to visit the algorithm and check it out. I'd like to talk about some other ways to enhance wellness. Because these are important, and I want to introduce you to a financial wellness curriculum that we have available at my center. Financial wellness impacts all the other wellness domains. I mean, really, that's true about all of them. But I think one of the issues that many people with mental health disorders face is that they do not have financial wellness and therefore can't pursue as effectively the other dimensions of wellness. We get a lot of support from our federal government to help people with mental health disorders work, but we don't get as much concern and focus on the the just as important need for economic security. Economic security is really key, and employment is only one aspect of economic security. Other dimensions include this notion of financial wellness that I'll go into in a little bit greater detail, financial literacy that I'll also talk more about, and long-term financial planning. I know that the members of NAMI Wisconsin are very involved in financial and estate planning to make sure that their loved one can live a useful, productive, meaningful life, even after certain relatives have passed on. What I mean by financial wellness is really threefold. First of all, obviously, it's the ability to have access to financial resources that cover your practical needs, and to know that you have those. Secondly is financial literacy. And third is feeling a sense of control over your personal finances, feeling a sense of economic security about your financial picture. I've mentioned the concept of financial literacy, like health literacy. It involves use of information, financial information. First, knowing where to find the information you need to manage your finances. Second, knowing how to evaluate it. You might find information about using a payday lender, but you need to evaluate that information and know that using payday lenders is a bad deal, because they may lend you some money, but the interest rate is huge, and you actually end up being worse off than other alternatives you could pursue. You need to understand the information enough to use it. And then, of course, you do need to apply the information in your own life. So that's what financial literacy refers to. And in introducing our financial wellness curriculum, I have to introduce you first to our solution suite. The solution suite is 18 free sets of materials. Some are curricula, one is an interactive toolkit, others are manuals that you can use on your own or in a group. And we took as our inspiration for the solution suite the Microsoft Office suite. I hope at least some of you are familiar with that. It's the set of software products, word for word processing, PowerPoint, which is what I use to create my slides for today, spreadsheet programs, Excel. These are all interrelated software programs that help people function in a business or organizational environment. And the solution suite for health and recovery consists of these kinds of products. We designed the suite, first of all, with the knowledge that these products have to be available for free. Our mental health system is severely financially strapped, and people won't use a product if it's expensive. Second, the product has to be deliverable or usable at very minimal cost. Third, we want these products to promote self-directed recovery and wellness self-management. We also need to make products available that require moderate to low intensity training of the people that are going to provide them. And that training has to be available in the suite so that people have all the tools they need within the suite to learn the product and be able to deliver it. We wanted models that complemented traditional behavioral treatment that were also supported by research and evaluation. And some are evidence-based practices like WHAM and RAP. We wanted products that respond to the documented needs that service recipients tell us they have, the goals they have for their lives, as well as the goals that we've been told are important from community mental health providers. We want to be able to support all of these products with free technical assistance. It's great if you get the product and you listen to the podcast and view the webinar and you have a sense of how to deliver it. But let's say you go to introduce it as part of a support group that you're running or part of a program that you operate, and you start having questions or running into barriers. You need to get some technical assistance from us or from the creators of this, from these products. And we put you in touch with those creators that will help you overcome those barriers and hindrances. And because we believe in peer support and self-help, and because we have a huge workforce that is continuing to grow, certified peer specialists throughout the United States, we wanted to make sure that at least the majority of these products could be delivered by peers. The suite was developed by the faculty and staff at my center in collaboration with Community Support Programs of New Jersey, which is a large peer-run statewide mental health program in the state of New Jersey. And there are 10 products that integrate behavioral health and primary care. And I'd like to just, because I know that this is hard to see, I want to zoom in and take a look, whoops, at some of these products. Let's see if I can get my zoomer to work. There we go. So one of these products is Building Financial Wellness, which I'll talk about in a little bit. Another product is called This Is Your Life, Creating a Self-Directed Life Plan. I don't know if you're familiar with the concept of person-centered planning. It's very different than treatment planning, and it's very important for self-direction. So this is a 49-page workbook that guides you through creating a plan if you want to do it on your own, or you can use it in a group. Express Yourself is a self-determination assessment. So you can do it on your own or in a group to assess the amount of self-determination you have in different areas of your life. Raising difficult issues with your service provider consists of a series of conversation starters that help you raise important issues to the person delivering services to you so that you can express your satisfaction and dissatisfaction with how the process is going and guide it more in line with what you're hoping to achieve. And this is based on research showing that the more two-way the communication is between a service provider and service recipient, the better the therapeutic alliance and the more positive the outcomes. We have a free version of WRAP available in the solution suite. We have Seeking Supported Employment, which is a booklet for people that are receiving vocational services so that they can gauge whether the services they're receiving are evidence-based and will help them actually get competitive employment, because not all vocational services are created equal. There's a cultural competency assessment guidebook and a self-directed care implementation manual available. So those are the products that promote self-direction. I'd like to take a quick look at the ones that promote health care and better physical health. One is a weight management intervention, an 8-week curriculum that helps people enhance their healthy eating and physical activity. Another is the Wellness Activities Manual that introduces people to new wellness activities such as exercise and meditation and yoga. There's an online diabetes education toolkit that people can use if they are experiencing co-occurring mental health disorders and diabetes. There's the Introduction to Wellness in 8 Dimensions, a manual that helps people develop a daily plan. There's a guide for conducting a health fair. There's a manual for journaling. I don't know if you're familiar with the wellness technique of journaling, but it's been shown in very rigorous research to enhance people's mental health as well as their physical health. There's a guidebook called Keeping Healthy After the Hospital for when people first get out of a psychiatric inpatient setting to make sure they are aware of the concept of recovery and what good services consist of. And then finally, there's WHAM that I referred to earlier, the Whole Health Action Management Intervention. Each of the products has a landing page, which is when you click on the link, you go to this landing page, and the landing pages have a format that is uniform. First of all, you click on the actual picture of the product in order to download it, and then you learn a little bit about what the product is, who it's designed to be used by and for, how it works. Does it use motivational interviewing techniques? Does it use stages of change theory? Does it use peer support? What resources are needed in order to use it or to teach it to others or deliver it to others. And then finally, what kind of experience is needed on behalf of the people that are going to deliver it if you're in a service delivery setting. There's a free podcast that you can click on so that you can hear a little bit about the tool and how it's been used. And then you learn how to use the tool in the webinar for that particular product. There's a series of slides and an audio broadcast of the training webinar, as well as a script for folks that are hearing impaired. And then finally, at the very bottom of the page, there's the all-important technical assistance button that you can click if you are using the product and have questions. I'd like to end by talking about a particular product in the solution suite that is designed to help people enhance their financial wellness. I've shared with you already the idea that financial wellness really underlies many of the other types of wellness. I think financial wellness is something that members of NAMI are very much aware of because they've watched their relative or the person they support, they've watched their struggles with economic insecurity and not having the money that they need in order to be able to live a full and rewarding life. So building financial wellness, there's a participant manual as well as an instructor manual, and it consists of 6 sessions. And I just want to briefly talk about what's in each of the 6 sessions to give you a flavor of what is covered. The introduction to financial wellness class talks about the fact that a lot of financial management isn't a time that you set aside in a day to work on financial management. It's really consists of a set of habits and routines that you fall into, as well as skills that you need in order to enhance your financial wellness. It also, this class focuses on what is personally important to you about your finances. And people engage in a financial strengths assessment. And if you're remembering your self-determination theory, as you can probably see, this is designed to get people in touch with what they're autonomously motivated to do about enhancing their financial wellness by building on their strengths and building on what's important and meaningful to them. In the second class, we talk about taking financial control, and we're introduced to a lot of concepts that are part of taking financial control, like needs versus wants. You need to have lunch today if you're going to make it through your afternoon sessions of this wonderful conference. But maybe you want to have a McDonald's hamburger and a shake and fries. Those are very, very different things. And understanding the difference can help you have some more financial control over the amount of money you have to spend. Spending triggers is another really important thing to know about. Many times your spending is triggered by things you're not even aware of, like advertisements or emotional moods that you're in, or different types of social interactions where you feel you just have to have a certain kind of shoes to wear or car to drive, for example. So feeling in charge of your finances has to do with knowing how to manage your money and being aware of these things. We also have a class, the third class, on budgeting, and get in touch with the idea that budgeting increases your financial control. You need to know what you have to spend each day, day, week, and month, and know what money is going to be coming in each day, week, and month in order to be in control. And budgeting is the way that you can make that happen. Also, budgeting helps you save money if that's something that is one of your financial wellness goals. Class 4 deals with savings and banking. You're introduced to the concept of the unbanked, which has always made me laugh because it sounds like, you know, the unwashed or the unhealthy. Unbanked refers to people who don't use banking institutions. And plenty of research shows that people who don't use banking institutions don't control their finances as well as people who do. So we're talking about credit unions and banks and other types of savings and asset accumulation organizations. The important part about using these is you don't want to have to pay for using them. So we learn about avoiding bank fees and how to choose a bank or a savings and loan, and what it can do for you and how it can help you. Class 5 deals with understanding credit and debt, how they work, how you can repay debts. People are introduced to a debt repayment calculator so that they can learn how much it will take to pay off their credit card debt, let's say, or if they were to borrow money to buy a bike or a car, what it would take for them to be able to pay off that debt. And also they learn about repairing their credit if they have bad credit ratings. And finally, in the final class, is a class on financial planning. People develop a financial wellness goal. They learn, first of all, that a financial wellness plan is different than a budget. It focuses on something that you want to achieve, something that you really appreciate and want to work toward. And if you don't have something like that at the end of the class, then you don't have to set a goal. But by this time, most people do. And you learn to develop action steps for the next month, the next 2 months, and the next 3 months that will move you toward achieving that goal. And then finally, there's a graduation celebration. So that's a look at our financial wellness curriculum. We've had some kind of financial wellness curriculum for 2 decades now, but this is a newly developed one that we designed along with CSP&J, and it's very, very popular. The evaluations for it have been very, very positive. And when you see what participants say they liked about the class, I think you can see it harkens back to some of the things I talked about when we were talking about self-determination theory. People like seeing their strengths and what they're interested in when they do the self-assessment. They like getting support from and role modeling the other people in the class and the instructors who share their financial plans and their financial struggles and successes with the class. So role modeling is possible, and people don't feel so alone. They learn that plenty of folks without mental health disorder have financial wellness needs. Knowledge acquisition, people like learning about the banking and the checking and savings account and all the specific information they get. They like the goal setting. They like being able to, and not being pressured to, but to come up with a goal that they really want to pursue, that's really important to them, that they think can make happen. And finally, they like acquiring new skills, like new budgeting skills and how to avoid debt. I want to note that about all the Solution Suite products is that if you're a person in behavioral health recovery or a family member, a service provider, you're welcome to reproduce the products for your personal use or your programmatic use. But if you're going to reproduce it or adapt it or modify it for commercial purposes or research purposes or educational purposes, you need to get our permission in order to do so. But otherwise, feel free to pick up these tools and use them. That's what they're there for. So I'd like to end by touching on some of the things I've talked about today, but also some other ways that we can promote wellness and self-direction among people that are recovering from mental health conditions. Obviously, illness self-management, wellness self-management, health self-management education that's designed specifically for people in recovery is really important, as is financial wellness enhancement. But part of doing these things also involves encouraging people to use natural supports, do things in the community that everyone else does, engage in leisure and recreational activities outside their homes, which they learn to do, for example, in our weight management class, safely during the COVID-19 pandemic, but still engage in them. We want to encourage the use of peer-to-peer self-help and mutual support, and encourage the growth of certified peer specialists as members of our workforce. We want to see more peers employed in traditional programs and mental health systems. We want to empower families, friends of people in recovery, and other supporters to not only help the person that is dealing with mental health difficulties, but also help themselves and learn to enhance their wellness, because their lives too have been impacted by their relative or the person they care about or care for. And finally, we need to engage in advocacy and political activism. I give this presentation to many traditional clinicians to whom a lot of this is news and who are really unaware of the evidence base for the models that I've talked about today. I want to encourage you all to explore some of the things I've introduced you to. This slide shows the web address for the Solution Suite, which I hope you'll explore. I hope you'll access the financial wellness materials and consider using them in your program or for yourself. I'd like you to go to our larger website where the algorithm is located and many other things that I wasn't able to touch on. And I hope that you'll follow us on Twitter. If you do so, you'll see almost daily tweets about new resources, new research, and related developments in the mental health and behavioral health field that you might be interested in. Here is my contact information. Feel free to, well, don't call me at that number because I'm not in the office right now, but you can certainly reach me at my email address. And I'd like to thank you all for joining me today and hearing what I have to say. Now I'd like to turn it over to Sita Deal, who's a NAMI Wisconsin board member from Madison, and she's going to moderate our question and answer and comment session. So Sita, please take it away.
Thank you, Judith. It's wonderful to see you. Hang on just a sec. I'm waiting for my video to come up here. While we're waiting for the video, thank you. This was amazing information. So deep and substantive and so useful. It's really wonderful. Thank you. So we have several questions regarding the financial literacy. The first, there are a couple here. One is that, can you see me now?
I can.
Okay, that's great. So how well do these skills work for people who live in poverty areas or who are on SSI? It just seems like high expectations, and can you do a lot with a little?
Yes, you absolutely can. And I want to point out, there's a lot of financial education classes out there. This one was designed for people who are living in poverty. It's designed for people who are on SSI and SSDI. And so it's perfect for folks in those situations.
And how about people who are in various marginalized communities? How well do these work for people in marginalized communities?
Well, we've done evaluations of the curriculum for folks in urban and rural settings and people of different races and ethnicities and other marginalized communities. So it works well for all of those groups.
That's great. And Mary Kay is asking whether we can do a class at our affiliates, or do we need training in order to teach this class, or information on how we can use these tools?
So you do need training, but luckily, and the good news is that the training is all contained in the Solution Suite. So you'd want to go to the landing page for the financial education curriculum or any of those tools. You'd want to read a little bit about it, read about what are the requirements of teaching it. This is designed to be taught by peers as well as non-peers. But for example, in this case, it should be led by people that have facilitated groups in the past. And it should also be led by people. You don't have to be an expert in financial management, but you do need to read the entire curriculum, click on all the links, be familiar with the information. But that's it. You're ready to roll.
Do you ever do webinars, or do some of your partners do webinars using this information that we could just tag into during the COVID particularly?
Yes, well, each of the Solution Suite products has a webinar that people can get together and view. Someone could access the webinar and then broadcast it to the other people in the group who want to use the material through Zoom. So all of these webinars are archived and ready for folks to use.
That's great. And somebody's asking whether there's a section on smoking cessation.
We don't have a product for smoking cessation, but it's so interesting you mentioned that. We've just been refunded as a center, and we're going to be developing 2 new products as well as additional things to put in the solution suite. One of those is a smoking cessation curriculum, and the other is a curriculum for managing your immune health, which
Cool.
is very, very important in the era of COVID. So those are coming soon. If you subscribe to our Twitter feed, you'll hear about them as soon as they're released. And thank you for asking that question. You set me up nicely.
That's great. And somebody is, Megan McLaughlin is saying, your website looks amazing. I'd like to hear how this came to be. Can you speak about how you developed all of this?
Oh, what a fun question. So, you know, this came to be out of many years of developing tools that never got used, that people had never heard of, that people couldn't afford, or they couldn't afford the training for them. And after many years of that, more years than I'd like to mention, a couple decades of work, we started getting smart, and we started saying, what is it that people without a lot of resources need, that doesn't cost a lot, doesn't require a lot of training, that has value because it's research-based, and how can we present it to them in a nicely packaged format, so that it's in a self-contained way ready to pick up and use, but also be able to answer the questions they might have, and maybe give them advice about implementing it in a new kind of environment. And that's the technical assistance component of it. So it really is our most up-to-date way of trying to take models that we believe in and have a strong research base that are recovery oriented, and make them available to the field for little or no money. A lot of effort, obviously, it takes to acquire any new you know, class or curriculum or tool, but really, you know, you just need to have the will and the desire to adopt these, and with a little help from us, you're able to do so.
It's great. It's like a virtual library or community center where the public can come in and find these things that have such deep thought going into them. So it's just really wonderful. Somebody asked whether these tools have been tested for people with less than average literacy, like people with learning disabilities or autism.
So these tools have not been tested for people with autism, but they have been tested for people at low literacy levels. And the tools are adaptable. In many cases, the tool itself, like if you pick up the RAP material, there's suggestions about how to help someone develop a RAP plan if they don't read or write. And in other materials, it's not in the tool itself, but ask for technical assistance. And we can give you suggestions for how you might use it for people with learning disabilities, or people with other types of impairments or challenges.
Yeah. Speaking of challenges, you were talking about the stages of recovery and what people can use in the various stages. So one of the questions was, how about people who cycle frequently in and out of episodes, or people who have a very difficult time getting going or concentrating, who have a lot of what we call negative symptoms?
Yes. So, you know, I think here we have to use the stages of change and think a little bit about what motivates people at, let's say, the pre-contemplation stage, when people aren't even thinking about change or picking something up, and what motivates them at the contemplation stage when they're thinking about this. And, you know, by and large, it's consciousness raising. It's using examples that they give you from your own life about what kinds of changes they want to make. And, you know, in most cases, these materials come after that. Maybe when you're in the contemplation stage, you might introduce somebody to one of the simpler materials, like journaling, for example, if they like to write. Obviously, it's a non-starter if they, you know, if the whole idea of journaling turns them off. Also another tool that many people who aren't sure they want to make any changes in their life really like is the self-determination, self-assessment, because they just are asked a series of questions. Can you control who comes into your apartment? Do you get to choose your own doctor? Do you feel that your human rights are being respected? And by answering those questions, they are taken off to websites that just give them the beginnings of information about how to enhance their self-determination in those areas. And that's consciousness raising. They're not asked to do anything about it yet. They're just asked if they might be interested in it because of some interest that they express or a problem that they describe.
Yeah, that's great. And we have a question about the social determinants of health. The thing about zip code rather than your genetic code determining your health. How does that work in places like Canada or the UK where they have universal health care?
Oh, wow, what an insightful question. Part of the reason your zip code determines your health is because we don't have universal health care. And I don't want to get political here, but the fact that we don't have that is one of the reasons why many of those social determinants are as strong an influence on people's health as the delivery of health care and engaging in health behaviors. So somebody connected all those dots there and gave me an opportunity to say something that I think is really critically important right now.
So it's better in those countries where they do have universal access to healthcare.
Yes, but the downside of the equation is that even with universal access, there isn't necessarily total equality and equity in healthcare. And so those determinants still operate, but to a lesser extent. Oh, that's a really interesting question. I'm going to have to take a look at what research has been done on social determinants in different countries. I tend to know a lot more about it in the US.
Yeah, that's great. Thank you. And one just clarifying question. What does WHAM stand for again?
Whole Health Action Management.
Wonderful. That's
the curriculum that introduces people to the notion of whole health, which really is just another way of saying all the social determinants together, and how to create whole health in your life.
That's great. That's wonderful. Thank you so much, Dr. Cook. This has been absolutely marvelous. You've given us so much food for thought. And so, and we really appreciate you taking the time to share. We would have loved to have had you here in Wisconsin to see our beautiful fall colors.
And I wanted to come to Wisconsin.
Maybe sometime in the future, we'll see.
Keep me in mind for a future conference when we're all back together again.
Yeah, we'll pick another thing from your deep array of things to talk about and have you come in person.
It's a deal.
So thank you so much. And now everybody, we're going to draw a name for the winner for our raffle basket because we're NAMI, Wisconsin. So Ellie, can you please pull up the wheel of names? Ooh, it's between Alexia and Cynthia. Oh, Cynthia! Woohoo! Congratulations with Cynthia. Cynthia will send you an email about your prize. And now everybody, please take a moment to answer a few short evaluation questions that will pop up at the end of this webinar. We hope you'll stay with us for the rest of the presentations today. They will be fascinating, maybe as fascinating as this one. And then finally, if you're not a NAMI member, please consider becoming a NAMI member or donating to help us continue to make a difference in the state of Wisconsin for those affected by mental illness. And also, please follow us on our social media platforms, Facebook and Twitter, and on our website to stay informed on upcoming events and information about mental illness. And thank you. Have a wonderful day, everybody.